Hi, my name is Kay Butler. I'm an adult gerontology clinical nurse specialist. What does that mean? Clinical nurse specialists are advanced practice nurses. We're educated to do a lot of different things, but I would say the overarching goal of a CNS is to close gaps in healthcare. I've worked on the peninsula in Virginia 24 years as a registered nurse. I am highly seasoned. I have seen many, many tragic things. My background is mainly case management and critical care. I feel like I belong in critical care, if you were to ask me. I started a business called RN The Know, LLC. And this business is not something I honestly would have consciously chosen. I just feel compelled. I feel like it's the right thing to do. Our culture is one that avoids discussing death because it's so painful. We end up making emotional decisions at a very difficult time. And I think that's what makes discussing death and end-of-life care so difficult, because it's so painful. I almost feel like I'm supposed to be a light in a very dark topic. I have various life experiences myself personally as a patient, and it really impacted the way I look at our patient care, how we treat people. Essentially, we need to have this discussion long before we're ill, before we're dying. We need to make sure we have advance directives. Every one of us over the age of 18 needs one. This alleviates others of making very personal decisions for us when we're unable to speak. I'm an officer of the court. I'm able to notarize these documents. They don't have to be notarized, but a lot of people feel better when they are. But to come see me, it's truly an educational experience. Even if you have an advance directive in place, I guarantee you will walk away with some knowledge, some aha moment. I've learned that a lot of people really don't understand what I'm doing. So essentially, I talk honestly to people, and I feel like so often we're not exactly honest. We kind of avoid the topic. Even our physicians are uncomfortable discussing this. So knowledge is power. I want to empower everyone I run into so they understand the deal. CPR is designed for people, I like to think of it, the 45-year-old who's on the morning run. They have the big one. Go to the cath lab, we open up the arteries. My experience as a critical care nurse, that is not what's happening. Overall, we don't let people die good deaths. And people look at me like I'm crazy. What do you mean a good death? It's possible. I don't think that most people, if you ask them how and where they want to die, they would tell you they want to die in a critical care room with tubes coming out of every orifice and then some. Most people want to die at home with their family, amongst their things. Very few people get the opportunity to do that. And I think it's because they just don't understand. So, palliation and hospice are two separate things. Most people roll them into one when indeed they're not. When we place patients on palliative care, the data shows they live longer and they live a happier life. People don't understand their Medicare benefits, how long it entitles them to be in a nursing home, how Medicaid works. They don't understand what assisted living is, how much it costs. I just truly want to educate people. I'm not selling anything. No insurance. There's no catch. I truly just want to help people understand the deal. I also have a program designed for adult children of aging relatives, and the focus of that is to help people age in place, live independently as long as possible and as safely as possible. There are medications that people over 65 should not be on. We have abundant polypharmacy going on. What does that mean? Well, that's when you're on 4 or more medications. And sometimes you really have to take a hard look at what the patient's drugs are. Sometimes the adverse effects of the medications are worse than not taking the medicine at all. I would never certainly advocate for dropping any medication without speaking to your healthcare provider. But having said that, a good review of your drugs is in order. I like to give people tools to help screen for dementia. Sometimes people slip into dementia. It's very insidious, which means it happens little by little. An adult child will go into their parent's home. Hey, Mom, why isn't the power on? Before they realize that Mom is not quite in touch with reality. She forgot to pay the bill for the past 4 months. And so that's when everyone moves to action, when the crisis happens. They beat feet to the bank to try to, I need to help Mom with her bills. And then they realize that, oh no, it is too late. So I also tell people all about the systems, how they work. A little heads up goes a long way. If I give a Medicare patient advanced care planning education, and that's essentially what I do. I don't like the term that's used. People don't understand what it means, but that's how it's billed through Medicare. I leave over half the money on the table with Medicare. It's a nice reimbursement, but I don't bill Medicare for the entire fee because, I'm trying to reduce costs overall in our system. I also teach first aid and CPR, American Heart. And I think that if a college student can come up with $75 for a CPR class, that's a fair price for the education I provide. If the Medicare person or recipient has met their deductible for the year, they only pay me $15. And so by reducing the amount that I bill Medicare, that means I can charge everyone else that same $75 instead of it being nearly $200 an hour. I just feel strongly that people don't understand. They don't know what they think they know. And truly, I try to make the conversation personal, inject a little levity, a little funniness to it, because trust me, that conversation is not funny in the moment. So come see me. Check out my website, www.rintheknow.com. Give me a phone call, 757-869-8529. I'm here by appointment only. It's just me, so I'm in and out. I've been trying to promote my business and have people understand what I'm doing. I do group sessions. You can register for classes online, pay securely through PayPal. I also see people individually. You can also book your own appointment online, whatever time works for you. My calendar is open. I can do house calls as well. So I truly just want to help people, and I look forward to meeting you and working with you. When you support an entrepreneur, you support a dream.